You're watching TVC Breakfast. The outbreak of the coronavirus across the world is bringing to bear the level of preparedness of countries to tackle health emergencies. Even countries considered as developed are struggling to find their bearing. Since the outbreak of the coronavirus in China, there has been palpable fear that Africa might crumble under the weight of the virus when it spreads to the continent. This is because there is a decay in the health sector due to years of neglect. In Nigeria, health facilities are in a rot. Many of the buildings are near collapse with few beds, and there has been a mass exodus of doctors over the years. With some top political figures and elites now down with the virus, some Nigerians have taken to social media to criticize them for failing to fix the country's health sector. Now joining me via Skype is a public affairs analyst, Ayodele Adewale. Good morning. Thank you for joining us on TVC Breakfast.
Thank you for having us.
All right, I'm certain that you have been monitoring the impact the coronavirus or COVID-19 pandemic has had on even countries that a lot of persons thought had the structure in place when it comes to health. And we see that how they are struggling under the weight of the pandemic. And while this pandemic was still moving across the globe before it got to Africa, WHO was raised some concerns with regards to Africa's weak health system, which includes Nigeria. And the pandemic has begun to, reveal and expose the strengths of many countries' health sector. So far, what have you seen, or how has this revealed how weak our health system is in this part of the world?
Well, first and foremost, my condolence to those who lost their families and loved ones in this pandemic. And we have two different cases before us, countries that have very good structures, but again, did not manage the information and did not take seriously the issue of this pandemic. They rather politicize it. And that does not mean that their structure is not big enough, is not enduring enough, but they only politicize and mismanage the information. Coming down to Nigeria is a totally different case. Here is a country that is still battling to put its structure right, particularly at the local level. Community health is a local issue, and if Nigeria has gotten its community health program very rightly at the local government level, we need not to be afraid. The central government only need to monitor and aggregate issues as it comes. Be that as it may, we still have an opportunity to do what is right. I commend the Lagos State government for taking a bold step to show leadership and direction in curbing this issue. But again, I want the Lagos State to also demonstrate a unified system where infrastructures can quickly be put in place. I must also commend the GTB for putting up that structure within 5 days. I bet you, if you look at the direct cost for purchase of material of that infrastructure that was provided at the Mobalaji Johnson Arena, it will not cost up to 400 million naira. Direct purchase, putting everything that we need in it. So it means that with the 10 billion naira that the federal government has given Lagos State, Lagos can replicate it in 20 local government of the old structure. It means that with putting that in place, even after the pandemic had gone, we can still use that as our primary healthcare structure for any misgiving that can come in future.
All right, if I may interrupt your line of thoughts for a minute. As much as we would commend Lagos State, Lagos is one of 36 states of the Federation. And we know that the virus moves around. It is not static. Unlike what we saw during the Ebola crisis, we saw that it was tackled head-on, and Lagos also, took the lead by ensuring that it curbed the move of the Ebola crisis at the time. But then a lot of persons said, what the lessons have we learned? If we took the step at the time, but it doesn't seem that we learned the lessons at the time, such that the structures we had in place at the time, we ensure that those structures remained on the ground, and so they are not optimistic that the crisis that we have been able to deal with over time, and now we may not be able to say we learned the lessons and we will build the structure after now.
The lesson we should learn is that we must put more funding into health. Without good health in place, there's nothing that can work. And this pandemic has been able to show us that global economy are shutting down rapidly. Nigeria should learn that at least 25% of its budgetary allocation must go into the health sector, building infrastructures and also building capacity. The Ebola issue, in terms of nature, is different from the coronavirus. You understand? Because this one is easily transmitted, and of course, they've also said through airborne and water view, people can get it more easily. I think Nigeria should have learned from what Ghana did. We should have shut our borders very early. People traveling into Nigeria, especially through the airport, should have been quarantined. Either you have it or not, they should have been given the best quarantine environment that will even make people naturally submit themselves into such processes. But again, we have to look ahead and see what we can do. I want a situation where Nigeria would deploy more of its educated forces that we have, and I use the word forces conscious. I'm talking in terms of medical forces. You can't deploy people from the School of Hygiene. You can't deploy people from various school of medical institutions, because these people are readily prepared to educate people and, of course, render services. If Italy can hastily graduate a lot of its medical students to fight this pandemic, I think we should also look towards that line. It's not just to give directives that people should stay at home and all whatnot, but we need to get the right people that can communicate effectively to the Nigerian populace and make them understand why they need to stay at home. Beyond that, Nigeria also must, take its data very consciously. We can't borrow
we have
data
to leave
from the
the discussion at this point, comrade. Thank you so much for